taking pictures.
You're gonna have to lay down.
We're recording.
You have to get somebody else to do
Shannon, do
it.
you want to record it for me?
Oh gosh, I am
Just turn it
technologically
around.
challenged.
It's already recording.
It is. Okay, cool.
The other way.
Oh,
The other way.
Recording yourself.
No, this way? Okay. Oh yeah.
I'm sure
Yeah,
she'd
like I said, I'm technologically
I'm sure she'd like
challenged.
20 minutes of you. But
Yeah.
if you're
You should see my phone. It's pretty simple compared to these.
Okay, so I'm going to try to do her. We're going to start working our way up, and I'm going to do my best to properly drape her while we do this. So next is her knee. What motions do I get at my knee?
Flex extend.
Flexion extension. So it's already extended, so I'm halfway home, right? Okay, so now I have to think about a couple of things when I stretch a knee. Most of the time, taking my knee up like this is flexing my knee, and it's going to serve me just fine, right? What am I accomplishing when I'm doing this? What am I accomplishing with all my passive ranges of motion?
Keeping that fluid.
I'm circulating that fluid, right? There is no way synovial fluid is getting in between those two articulating bones without me working it in there. So you ever spray WD-40 on a hinge or something, you got to pull it back and forth a couple of times to work the fluid, the grease down into the hinge to get it to work. And the same thing with your knee. I got to work it back and forth because the lubrication is being made on the outside. So I'm trying to lengthen muscles, and I'm trying to circulate circulate this fluid. There's a couple of muscles that cross my hip and my knees. You may know any of them. One of your four quads.
Oh, rectus.
Rectus starts at my ASIS and goes to my patella. So it crosses my hip joint. My sartorius crosses. Okay? So most of the time those two aren't going to get super tight on me without the others, but they can. So if I'm stretching her like this into flexion, am I stretching her sartorius or rectus? Not really, because I've got her hip flexed. So that's why you see in the picture one of the alternative positions for stretching. Stand up back. Stand back. And I'm just going to drop her knee off here. Now I've got her rectus on a lengthen, and I can bend her knee back this way. Now I'm stretching everything. Okay.
What's the one that attaches then to the tibial tuberculus?
Well, your quadriceps tendon attaches right there, and it's attaching lateralis, medialis, vastus medialis, vastus lateralis, vastus intermedius, and rectus femoris all come together and have a common tendon right here. Rectus has that common tendon, but its origin, where it begins, is on the other side of the hip, where all the rest of them are on this side of the hip. Okay, so again, I'm going to help support her leg a little bit so she doesn't feel like she's falling off the bed here, and I can. What you'll notice is when I'm ranging motions, I don't like to have my hand more than a joint away from whatever I'm stretching. So I'm not going to stretch her, and you'll notice it more in the upper extremity, but I don't want to stretch her knee from here because now I'm stretching ankle things too. So I always want to be distal to the joint with one hand, but I don't want to cross another joint. And then I have to be proximal with this hand to assist, and I need to give her enough comfort and stability that she doesn't feel like I'm going to drop her leg, right? So I'm going to be here. I'm going to raise her up. And I can go up and down. I'm supporting under her knee, up and down, up. I might have to get my hand out of the way to get it there. You'll notice what else am I doing? When I'm flexing her knee, what else am I having to flex? Her hip. So sometimes I'll do their foot, and then I'll start on the hip, and the knee's just going to kind of get done while I'm doing my hip. So I'm going to go straight into her hip here. So one of my first motions is going to be hip flexion. Okay, so I can go all the way up here. What kind of infeel is that probably going to be?
Soft.
And I come down. I've got a support here. I got a support here. I got to go all the way up. Push into that. All the pressure is coming from this hand that's on this side of her knee joint. I don't want the pressure coming from back here, because now I'm gonna twist her knee while I'm trying to do this, right? So I'm gonna be down here, I'm gonna be up, pressure's coming from that hand, flexion, extension, flexion, extension. All right, what's another motion? How many motions do I have in my hip?
6.
6, so we've done flexion, a little bit of extension. What else?
Internal, external
Internal and
rotation.
external rotation. I got 2 chances to do this. The one that's gonna be least traumatic to everything else is to hold just below the joint and rotate her leg in and out. So I can go external rotation, internal rotation, external rotation, like I'm rolling dough. All right. My other option for that, some people are really tight or really big and I can't do that, and I'll want to bring them up here, and I can rotate them this way. The problem is if I start, am I internally or externally rotating?
External.
That's external rotation, even though my foot's going in because my thigh is turning out
The hip.
at the hip, so I'm externally rotating her hip. If I'm doing this where she's probably feeling that stretch, or she's feeling it down here, but she's also feeling it in her knee.
Right.
Right? So I have to be really careful if I'm gonna stretch at 90 degrees, that the turning motion is coming in the thigh and not at her foot. So I'm supporting her foot, but she's feeling the pressure, hopefully, from this hand here, turning her leg out and turning her leg in. Because I really don't want
Feel
to
it more when you internally rotate.
feel it there.
Inside.
Yeah, because so I gotta be really careful not to pull with this, my left hand here, because she's gonna feel it right there. It could hurt her ligaments. So my first choice for internal and external rotation is always with the leg out. In and out. All right, what's the next one? Ab and adduction. So again, I'm gonna worry about my draping here a little bit. I'm supporting right here. I'm abducting. I'm bringing back to midline and then past midline to make sure I got all my adduction. So I'm gonna go ab and add. You see me, I'm a little bit low here. You see me stepping away from it and stepping into it. You see me stepping away from it and stepping into it. You don't see me going. You laugh, but I'm gonna see people doing that.
Oh, yeah.
I'm gonna step into it, I'm gonna step away from it. You don't see me using a lot of arm, I'm just kind of holding it here against my body and, all right?
Is it okay? I noticed yesterday when I was doing that, like I had to back up a lot.
Eh,
Like I couldn't do one
They're really
step.
stretchy,
Is
and
that
you got little short legs.
Take more steps.
It's okay.
Yeah.
Yeah, I
to
mean,
have
I,
all that movement?
you don't wanna get tired. I'm kinda lazy, so I try to minimize the movements.
Yeah,
All right.
yeah, always 'cause it's
So I got ab and
it's
add,
not lazy.
internal, external, flexion, extension. If I'm really worried, you got your patient that doesn't tolerate prone, you got your patient that can't stand up and actively flex their hip. Sometimes we need to try to extend, kind of like we did our knee flexion. So I might need to bring her all the way over here to me. Now my concern here is her feeling like she's gonna fall off the edge of this. But I can actually drop her hip off the edge here a little bit and stretch, feel it right in there. Right? And actually get a pretty good hip extension there.
Did you roll
So
it on
that's
her
hip,
side?
that's hip,
I can also do that. I
Yes,
can roll her on her side.
hyperextension.
Now, if I roll her on her side to do it,
yeah,
that's an excellent
Stabilize
question.
the-
I've gotta stabilize up above
yes.
when I'm doing that. So I usually have to hold her leg under here and hold the whole weight of her leg. And then I've got to push in her cheek to really get that, because if I just do this, it's all coming from her trunk.
Exactly.
She's not getting hip extension.
So why would you, why would you have to choose the sideline way to do it? I mean, what
Um,
would make you?
If they just, if I've got someone that weighs 400 pounds, if I drop a leg off there, they're just gonna roll straight onto
Okay.
the floor.
Yeah.
Or if I'm on a really soft bed, try doing it on your bed at home. Try ranging someone in their bed, even if they're tiny, and you get them over to the edge and they drop that leg off. it's just gonna roll
Can
them
you
out.
show
So if I
us-
don't have a hard surface, it's hard to drop the leg off. I would prefer to do that, or even put them prone. Can I get Sean your seat for me? Now I gotta remember to move around to the other side, right, because I'm still in this leg.
Yeah.
I've seen people do that, roll them over and stretch the wrong hip. So now I gotta get in here, and I still have to stabilize here to lift. Because I don't wanna just roll her over when I'm lifting and not get my hip extension.
And do you apply quite a bit of pressure?
Am I applying quite a bit of pressure? Yeah.
Yeah.
You will not be applying as much pressure.
It's not like painful pressure.
Yeah, it shouldn't be, I mean, I'm just stretching.
And that's so you can,
So, yeah, I gotta push pretty hard here to, if I don't.
To get
but
the stretch.
See how her, can I have him drape you for a
No,
minute?
that's fine.
If I just lift her up, what's happening? I mean, there's her hip bone. Have I stretched her hip yet? I've gotten,
Just lifting her up and down.
so if
You're
I
just
don't,
lifting
if
her
I
up
don't get
and
a
down.
hand in here and stabilize her there, now I'm stretching her hip.
Okay.
What am I stretching? What
Like a
muscle,
little,
Veda?
well, I don't know the name of the muscles, they haven't done the quad, part of the quad there, I'm sure.
Well, a little bit of rectus, but what's your major hip flexor?
Hamstring.
What's your major hip flexor?
Oh, you talking about the
Iliosaurus.
iliopsoas.
Yes.
Yes.
Ah,
no.
Oh.
You gotta go outside. You gotta go out.